So Dundee Healthy Living Initiative was established in 2003 as a result of a 2-year process that pulled together an application for the Big Lottery Fund. The funding application drew heavily on some social research that we undertook in Dundee's 4 priority areas, and these health audits, as they were known, engaged with over 1,400 people living in these areas to ask them what they felt mattered for health and well-being, what barriers they had to good health, and what the potential solutions might be. Equally Well is the Scottish Government action plan to tackle health inequalities, and around 10 years ago Dundee hosted an Equally Well test site with a focus on improving community mental well-being. The test site team acted as a catalyst for change and worked with services and the community to address the wider influences on mental well-being, such as green space, access to services, low income and so on. The team also designed and delivered a training programme to support services and community groups to adopt poverty and inequality sensitive practice, and this programme remains part of the city's learning offer today. The community health team merged the work of both the Healthy Living Initiative and Equally Well, and we still strive to support services in the community to be part of the local response to tackling health inequalities in the city.
There's been lots and lots of great memories working with the team. Some of the ones that do stand out though is when you've worked with a group of people and you've worked with them for quite a long time and you see them progressing on to do other things.
In Charleston area we had the Charleston Healthy Action Troopers, which was a group of young mums who all came together through working with other partners, and at the time Charleston Community Centre was getting built, so there was no place for them to meet, and we ended up, we were in the school but they opened their own shop, and it was kind of a health shop where people from the community could come in, nurses would come in and do health checks, etc. So all these kind of things have added to the development of the project and our enjoyment of it really.
I mean, I think going back to the early days, one of the biggest impacts we had that we were delivering tremendous amounts of weight management groups and smoking cessation groups, and I've had hundreds and hundreds of people come to my groups that have lost weight and stopped smoking, and that's a big lifestyle factor that improves their quality of life and their healthy life expectancy.
So I was a really young mum living in Charleston. I moved to Charleston from the city centre, and when my youngest son was 6 weeks old, my health visitor told me and advised me of different things that were on in the community, and the first thing I ever went to was my only opportunity where there were things with childcare, and it was an exercise class. It was the only opportunity I had when my children were little to have a bit of support that was out of the house and having the opportunity to just be an adult and not just be with the children all the time. So it made a really big difference to my mental health, my well-being and my ability to be a better mum at the time as well.
If it wasn't for the community health team, I wouldn't have been involved in any of this. We've been involved in the community health team. That one group led to another group to another group. It has a domino effect on you, and before you know it, it opens a lot of doors for a lot of people to come in, and they're very welcoming, and nobody judges you. People are very friendly, so it's a good place to be.
It gives me confidence. When I first met Christine, I had no confidence at all. I was so isolated, so alone, and I've got so many friends now. I've got so much qualifications behind me now. I've got so much experience, and it's setting me up for life.
Yeah, I did a talk session about social media and gender ideology, and I spoke to everyone about all the history of it, and I was able to, it's the first time I've ever done that, so it was a good confidence building. Well, for me, when I joined the course, it was me being able to get out of the house and socialise more, and I think that helped my mental health as well as my confidence.
Well, again, it's people who would normally be in the house and don't get around, and as I say, it gives them relationships with other people and a lot of friendships. as I say, that's one of the major things that we find with models. As I say, they develop the friendships with other people.
A lot of them tell us that they love coming to the walking group because it gets them out of the house, and we chat all the way around. We chat to different people and that, so we do.
We've been coming about a year and a half now. Stephen just loves it. Yeah. Loves it. The people here are great. Yeah, they're just fantastic. It's a great get together. Yeah. And it's since we came, it's just expanded. Yeah. I think there was only about 15 when we first come, and now there's about 40 odds going. So it's really, really good. I would recommend it to anybody.
Me too.
Helps my recovery. I'm not sure in which way, because I end up stressed out every single day, but it helps me recover, like helping other people recover it. Like all the wrong things that I felt like was wrong in my recovery, I like to try and help other people get their right path for their recovery, because what people need to understand is not everybody's recovery is going to be mirror image of someone else's, and you can't put someone's recovery up against another person's recovery.
By socialising with people in the Hilltown Activities Group, it's an hour that you have to yourself and that you can relate to people, and if something's mayhem at home, you get out of the house, and for that hour you can just vent your spleen, do your exercise, get the endorphins going, and when you get home it's like fresh start.
Well, the benefits I personally get are it keeps me off the couch. I'm meeting a brilliant bunch of people. The girls that take the class, Alison particularly, she's really, really good. She motivates you. And for elderly people like me, that's a bonus.
Brings the community together as a community, the way community should be. Because over the years, communities are kind of drifted apart, and you've got different groups in the community where, like Resolve Involve, it's people from different backgrounds that are coming into the group, the health issues groups, the cooking groups, it's all different people with different backgrounds, and it's just coming together and not judging anybody and just feeling safe and secure, but without the community, so then we're not isolated in our own home, and it helps our mental health. And it makes us feel better, and if we're feeling better, it makes other people feel better and more willing to come and attend other groups, and then it could help them. They might want to then become volunteers in the community.
I think it encourages local people to know that they can change things.
Mm-hmm. They do have a voice, and they can make a difference. That's the main thing.
And I think when they see others doing that, it gives them the courage to step out and do that.
Mm-hmm.
So.
I think that's a good part of it, because when they see, oh, they're just three wifeys, basically, because that's what we are, three wifeys, and if we could make a difference and we could make people listen and make people pay attention to what we're saying and want to help, then that's good, because it gives them a voice for themselves. And the bigger the voice, the more help that they'll get, as far as I'm concerned.
I think probably for me one standout memory is when we did manage to get a representative group of local people involved in the management and development of the project as a kind of formal part of our management structure. So we had a community subgroup that had representatives from all across the city who were involved in participating or leading our activities, and they did some fantastic work from organising events to promote the work of the project, to liaising with their elected members both at a local and a regional level. They looked at new policies and plans that were coming out and really had that kind of sense check and that local inequalities eye on what was being proposed, and it was just wonderful to see local people actually having that voice and sitting around a table at a management group meeting as equal participants, and that was just a really kind of a positive development for me. And it's interesting now to see the Community Health Advisory Forum, who are kind of the next permutation of that, and it's going great guns as well, so we're really, really proud of that.
Community-led health is about
tackling health inequalities and achieving social justice by bringing communities together to support them to develop knowledge, skills, confidence and social networks to influence decision-making processes and to tackle issues that are important to people. So from the collective resources that local communities have as a result of community-led health programmes, they have greater influence and control over decisions that affect their life and their life circumstances.
I wanted to join the team because I'd done my last job for quite a while, so I'd been in the post 9 years, and in that job I supported families and parents, and that's something I really enjoyed doing. I really wanted to be able to provide a service and put on sort of different groups within the community to get people to come along to help them support their own health and well-being.
Yeah, similar to Kim, I mean, my impression and my sort of involvement in the community health team in my previous job was it was always a really hands-on community project that worked with local people and issues that really mattered to them, and that was what I had known about it, and that's really what attracted me to the post, and it is exactly what it says. It is.
I came out of uni and went into a job where I didn't really get to practice community education, and I wasn't really getting to work with a diverse amount of people, and I think, yeah, seeing this job, it's more hands-on and you could get to do a lot more with communities and hear people's voices and find out what it is that they want to do to help benefit their health.
I think for me it's just to maybe make sure like I'm fully established in the community I'm working, and making sure like we're taking on board what people are asking for and offering, and we're having that bottom-up approach. I think a lot of time there is like priorities and that's what we're falling to, but actually to make sure people feel valued and listened to and what are acting on the views and the wishes of local people to support them to access service or make changes to service that are going to impact themselves and their communities.
Moving forward, the community health team will be looking to strengthen the influence that local communities have in Dundee over decision-making processes and over the health and well-being of their communities. To do that, we're going to be expanding the health issues in the community courses that we currently offer to more areas across Dundee. And also recently we have been working with a group of people from across the city who have been really actively involved in a range of health and wellbeing projects in their community to form a community health advisory forum. And that community health advisory forum will be really there to try to ensure that local and citywide decision-making processes are responsive and take into consideration the issues and priorities that are important to local people in Dundee.
So in terms of being involved, I think that, you know, that involvement all those years ago helped me to build my confidence. It helped me to meet new people, and at the time, you know, I think it was that work around, you know, social isolation, being involved, being supported, feeling, you know, belonging, that you were part of your community, and from that work as well, I feel that has probably really changed my life, because it gave me the opportunity to volunteer, to get to know some of the different routes for me and what I would want to do in terms of further training and learning. And from that I went to university. I did a social work qualification. I worked with children and young people for a number of years, and I'm still really passionate about, you know, community engagement, about supporting, about, you know, doing all that kind of work. And I feel that a lot of those values and the opportunities I had then have really developed and supported me into being who I am today.